Removal foreign body from external auditory canal, without general anesthesia. With general anesthesia. Under direct visualization, the physician or technician removes a foreign body from the external auditory canal using delicate forceps, a cerumen spoon, or suction. In the case of a live insect, oil is dropped into the ear to immobilize it before it is removed. If a child or an adult cannot tolerate the procedure while awake, it is performed under general anesthesia. Indiana 69205. Code 69205 is also reported in cases where the foreign body is so large, an incision is made in the external meatus to enlarge the opening before the foreign body can be extracted. Removal foreign body, intranasal, office-type procedure. Requiring general anesthesia. The physician removes a foreign body from the inside of the nasal cavity, in the office for 30,300 or under general anesthesia for 30,310. Foreign bodies are defined as objects not normally found in the body. An object may be embedded in normal tissue as a result of some type of trauma. Topical vasoconstrictive agents and local anesthesia are applied to the nasal mucosa. A small incision may be necessary to access the foreign body. Blunt dissection and retrieval of the object is performed with hemostats or forceps. Sutures may close the mucosa in a single layer if the size of the dissection requires. Removal foreign body, intranasal, bilateral rhinotomy. The physician removes a foreign body from deep within the nasal cavity, accessing the area with a lateral rhinotomy surgical approach. This foreign body is located in an area of difficult access and requires complex surgery to remove it. A full-thickness skin incision is made from the nostril extending along the nasal alar rim and continuing superiorly. The incision can extend to the medial aspect of the eyebrow if necessary. The lateral aspect of the nose is retracted, exposing the bony structures beneath the soft tissue. Blunt dissection and retrieval of the object is performed with hemostats or forceps. The surgical wound is closed in layers. Exploration with removal of deep foreign body, forearm, or wrist. The physician removes a deeply implanted foreign body from the forearm or wrist. The physician incises the site and dissects down to reach the area where the foreign object is embedded. Exploration of the site is done. Separately reportable X-rays may be taken to locate the object. All parts of the object are removed. The wound is sutured in layers. Removal of foreign body, upper arm or elbow area, subcutaneous. Deep, subfacial or intramuscular. The physician removes a foreign body of the upper arm or elbow area. If the foreign body is a result of trauma, an open wound may already exist. The physician may make a separate incision or access the foreign body through the open wound. More extensive dissection and a larger incision may be necessary for a deep foreign body. Once the foreign body is visualized, it is removed. The physician may also debride any surrounding damaged soft tissue. The wound is irrigated. Drains may be placed in the wound and the incision repaired in layers with sutures, staples, and slash or stri strips. A splint may be applied to limit elbow motion. Removal foreign body, foot, subcutaneous. Deep. Complicated. Subcutaneous refers to something under the skin. An incision is made through the skin and it is reflected to expose the foreign body. It is removed and the wound is irrigated and the wound is closed. A dressing is applied and aftercare may include antibiotic injection into the wound and orally. Weight bearing is allowed as the wound heals. Removal of foreign body, pelvis, or hip, subcutaneous tissue. Deep, subfacial or intramuscular. The physician makes an incision overlying the site of the foreign body in the pelvis or hip. The foreign body is removed from the subcutaneous tissue. Indiana 27086. Deeper dissection is required. Indiana 27087, and more attention may be given to possibly damaged vessels and/or nerves. The physician irrigates the wound. The incision is repaired with sutures, staples, and/or stri strips. Removal foreign body, deep, thigh region or knee area. The physician removes a foreign body, i.e., nail, piece of wood, in the thigh or knee. For a foreign body in the thigh, an incision is made overlying the object. Tissue is dissected around the object. The physician may need to suture damaged muscle or other soft tissues. The wound is irrigated with antibiotic solution. The incision will typically be closed, unless an infection is present, in which case it will be left open temporarily to drain. Removal of foreign body, shoulder, subcutaneous. The physician removes a foreign body of the shoulder. The physician makes a small incision over the foreign body and reflects the skin to expose it. The foreign body is removed, the wound is irrigated, and the skin is closed with sutures or stri strips. Removal of foreign body, shoulder, deep, subfacial or intramuscular. The physician removes a foreign body from deep within the shoulder, such as an artificial shoulder joint. A long incision is made overlying the shoulder. The physician dissects through each layer of tissue down to the bones in the shoulder. The shoulder joint is exposed. The physician may debride any inflamed synovial or other scar tissues. The foreign body is removed from within the joint and from inside the humerus bone. The physician irrigates the joint with antibiotic solution. The wound is closed in layers unless there is infection present. If infection is present, the wound is left open to drain.